The purpose of the study was to evaluate the safety and efficacy of silicone rod frontalis suspension surgery in severe congenital ptosis. The efficacy of this surgery was evaluated by following parameters: by noticing the marginal reflex distance 1, post-operative eyelid symmetry, which was the difference between MRD1 of the surgical and fellow eyelid, vertical palpebral fissure height, eyelid contour, foreign body sensation, exposure keratopathy, and silicone rod extrusion. This was a prospective case series study done in 23 patients of 28 eyelids. Those patients were included in this study who had severe congenital ptosis of more than or equal to 4 mm and poor levator function less than 4 mm. The patients who were not included in the study were patients having poor Bell's phenomenon, uncorrected vertical squint, acute or chronic infection of eye or eyelid, any dry eye syndrome, and having any previous ocular surgery. Detailed history was taken followed with thorough clinical examination, and preoperative and postoperative photographs were taken for cosmetic evaluation. After taking informed consent from the patient or legal guardian, the patients were operated by Fox pentagon method of frontalis suspension procedure using silicone rod. This is a silicone rod we use is an oral sling manufactured by Oral Lab Madurai. This is the Fox pentagon method which we use two scratch incisions were made in the upper eyelid 2 to 3 mm above the eyelid margin. 2 stab incisions were made on the medial sapho eyebrow and lateral 1/3 of the eyebrow, and the central incision, the stab incision was made midway between these two incisions. The needle was traversed through the central brow incision, exiting it on the suprabrow incision. Then the needle was traversed through this eyelid incision, making it the second limb, then through the epitarsal plate to the another eyelid incision, then through another suprabrow incision, and finally the needle was passed through the central brow incision. This was the passage of the silicone sling. The silicone sling, then we saw the contour of the eyelid and maintained the eyelid height. The silicone sling was anchored to the central incision and passing the suture through the frontalis muscle. The follow-up of the patients was done at first week. Vertical fissure height, marginal reflex distance 1, eyelid contour, lack of thalamus, and other complications were noted. In our study, the majority of the patients, 56.4%, were in the age group of 16 to 25 years. Females comprised 56.5% of the total number of patients. This is the age and gender-wide distribution of the patients, in which we can see that the majority of the age group was 16 to 25 years, little vary in pediatric age. 78.2% of the patients were of unilateral ptosis, where 21.7% of patients were of bilateral ptosis. This is the mean preoperative MRD1, which was -1.56, and the mean postoperative MRD1 in the first week was 3.32, and in the 12th week was 3.11. We can see no significant change in the first week and 12th week MRD1. Statistical analysis was done between mean preoperative MRD1 and mean postoperative MRD1 values at 12th week using paired t-test. Results were compared between MRD1 values at first and 12th postoperative week. There was no statistically significant difference in the marginal reflex distance at first postoperative week and 12th postoperative week, which means that the results were consistent in our study period. The median preoperative and the postoperative was 3.3. The preoperative eyelid symmetry difference was 5.7 in unilateral and 5 in bilateral, which decreased to postoperative symmetry of 0.7 and 0.5. Our results were we had a satisfactory postoperative eyelid symmetry in 82%, 6% of the cases. Satisfactory postoperative symmetry as denoting was seen in 13% of cases, and we got a lack of thalamus in 30% cases. The complications, we had in 3 cases we had complication. One was suture granuloma, extrusion of silicone rod, and recurrence in 1 case respectively. The cosmetic outcome of this surgery was assigned by one of the following categories, considering the eyelid height and symmetry in terms of marginal reflex distance. These were our categories of good, fair, and poor. Good seen in 83.3% cases. The unilateral cases fair in 11.1 and poor in 5.5. This is a patient of unilateral congenital ptosis after this is the post-operative photograph at 12 weeks. In bilateral cases, good results were seen in 80% and poor in 20%. This is a bilateral preoperative photograph and this is a post-operative photograph at 12 weeks. The complication which we got is of extrusion of silicone rod and recurrence, and there is a granuloma formation in one patient. This study shows similar results as seen in previous studies on silicone slide. There was Carter et al. Who studied 35 patients who underwent silicone ptosis repair. So, in the conclusion, use of silicone rod is an effective surgery, less surgical time. Thank you.